Greet Gill, Shadow Minister.
It's my pleasure to serve under your chairmanship, Ms Murray, and I would like to thank my honourable friend, the member for North East Fife, for securing this hugely important debate, which I think will be an issue that will define this year and the way this pandemic is remembered in history. Can I also thank members from across the House for their contributions? From the very start of the pandemic, Labour and I have been clear that achieving global vaccine equity is a moral and economic imperative. Yet the government has failed time and again to answer the calls from our partners abroad, and the result is a catastrophic disparity between the countries that have and the countries that have not. And the facts speak for themselves. While in the West 70% of adults have received a vaccination, many people in the world's poorest areas are yet to receive a single dose. Nowhere is the COVID divide clearer to see than in Africa, where in many countries immunisation rates are below even 1%, and 3 in 4 healthcare workers across the continent are yet to receive a single dose. The EU, the UK and US received more doses in the last weeks of 2021 than African countries received all year. We know how desperately important it is to get jabs into arms from our own struggles with the pandemic, and we of course encourage everyone to get vaccinated. It is the way we beat this virus. Yet why is it that when it comes to the rest of the world, we lagged behind the EU, the US, France, Germany, Italy, Canada for doses donated to low and middle income countries last year? I know that the new Foreign Secretary is perhaps a bit distracted with her own leadership ambitions at the moment, but seriously, is this global Britain? The world is right to wonder why this government has fallen so far behind. While once Britain could be counted on to be a dependable and trusted leader on the global stage, our reputation has been tarnished by the government's failures to heed warnings of the virus mutating in less vaccinated regions and to take decisive action. With the COVAX facility falling short of its pledges by over 1 billion doses last year, revising its forecast for 2021-22 down by 25%, and revelations that many vaccine producers not only failed to prioritise deliveries to COVAX, but they actually violated their contractual obligations. Now is the time for outward-looking nations to redouble their efforts to vaccinate the world. This is not a question of trying to achieve the impossible, nor is it a choice between jabs at home or jabs abroad. We have the expertise, we have the technology, we have the resources and the production capacity. So what's stopping us? Well, firstly, a shameful level of mismanagement. It's an absolute scandal that despite repeated promises by the government to distribute surplus vaccines, more than 600,000 doses of the AstraZeneca vaccine had to be destroyed after passing their expiry date in August last year. The same month it emerged, the UK took 500,000 doses from COVAX, meant for poorer countries. What on earth was going on? And the reality of the global vaccination effort now is that the increasing reliance on ad hoc donations from high-income countries to fill the gaps has seen vaccines arrive late to countries with little notice and limited shelf lives, making it impossible for them to plan vaccination campaigns and increase absorptive capacity so they can get those jabs into arms. I note that of the 30 million doses that the UK pledged to donate last year, only a third had been delivered by November, with the government leaving it to the absolute last minute to fulfil their promise. Life-saving health interventions must not be treated like an essay deadline. We must do better and give countries adequate notice with transparent, ambitious timelines and a good level of shelf life on doses when they arrive. Not only is striving for vaccine equity a moral imperative, it's also wholly in Britain's best interests. And we know from painful experience that viruses evolve and mutate. Our country's heroic efforts in the fight against COVID have been seriously set back, not once but twice now, with the emergence of the more transmittable Delta and Omicron variants. Neither of those variants originated in the UK, yet once they arrived here, they quickly swept the country. It is why it is so important that our fight against COVID is a global one. We know with great sadness that another strain of this deadly virus will emerge if we continue down our current path. That's why it's just unbelievable that the government cut research programmes tracking variants by 70%. And as Gordon Brown so rightly pointed out, the grim truth remains that until no one anywhere lives in fear, then everyone everywhere lives in fear. Simply put, the current pandemic is not simply something that we can booster our way out of. And as the emergence of Omicron has showed us, As soon as a booster is administered in the West, another strain may mutate elsewhere, most often in the fertile breeding grounds, where vaccinations are difficult to access. But we must remember that striving for global access to vaccines also makes economic sense. COVID is not just a health emergency, but an economic emergency. And instead of being preoccupied with how much global vaccination would cost, we'd be better served by considering how much it would save. Therefore, will the Minister confirm how much it costs us per dose to procure, and at what price doses are currently being accounted for on the government ledgers? And does the Minister agree that donations to lower middle-income countries should not be counted towards the 0.5% ODA target? The sooner we can put an end to the health crisis, the sooner we can put an end to the economic crisis. Only when we can confidently say the pandemic is over will global supply chains be able to adjust, our economy recover, and businesses have the confidence to invest and thrive. As the Managing Director of the IMF put it, the cost of ensuring global vaccine equity would be dwarfed by the outsized benefits, with economies likely to see the highest return on public investment in modern history. This isn't rocket science, just common sense. And common sense the opposition has been pleading with the government to adopt since the pandemic first began. If the government is serious about global Britain, it also needs to be serious about global health. If we are to have any chance of stamping out this virus once and for all, we need to work with national governments to ensure that those with the greatest need can access vaccines, regardless of their location or the depth of their pockets. Labour has led the way on this issue, setting out the steps the government should take, and I would encourage the Minister to look at the 10-point plan that the former Shadow International Trade Secretary and I laid out in May last year. And in particular, I would urge the government to show global leadership by working with other governments to negotiate a temporary patent waiver with the World Trade Organization to allow developing countries to speed up their own vaccine production. The UK is out on a limb on this now. The majority of countries around the world have expressed support for the TRIPS waiver. It is backed by hundreds of human rights lawyers, IP scholars, civil society organisations, economists, medical experts, scientists, most Commonwealth countries, the First Minister for Scotland and for Wales, India, South Africa, New Zealand, Australia and the US. It is only the UK, Switzerland and the European Union who are still blocking this. There are over 100 manufacturers across Africa, Asia and Latin America with the potential to produce mRNA vaccines. Let's give them the tools to manufacture more of the vaccine and get the world jabbed as soon as we can. Finally, I urge the government to leverage the UK's world-leading expertise and work in close cooperation with national healthcare providers and trusted partners on the ground to ensure systems are in place to allow for vaccines to be distributed in an efficient and swift manner. After all, there's little point in turbocharging global vaccine production if they cannot be distributed to those who desperately need them. As we enter the new year, the government has an opportunity to finally do the right thing. As a proud, outward-looking nation, we simply cannot continue down our current path, looking on as spectators while the world suffers a vaccine apartheid. And to do so would not only be grossly unjust, it would also be catastrophic to the UK's self-interests, our reputation, the world economy and our security. The government must commit here today, without qualification, to take the urgent steps Labour, Gordon Brown and so many more have urged along, to look beyond our borders, recognise our common mutual interests and do the right thing. Let's make 2022 the year we close the great COVID gap and do our part to vaccinate the world. Thank you.